We welcome back Dr. Drew McPhail of McPhail Chiropractic back to the show to talk about a new treatment for knee pain, osteoarthritis of the knee. Dr. McPhail also brought along patient Nancy Stone to tell us about the wonderful effects of the LKP protocol. First off, doctor, what is the LKP protocol? And then we're going to ask Nancy a couple of questions prior to coming into initially your office.
Okay, the LKP protocol, it's a multimodal approach for chronic knee pain, bone-on-bone knee pain, arthritis of the knee. And when we're dealing with knee pain, there's several different causes. And sometimes with the patients, they tore meniscus or something in some athletics, or stepping off of stairs or something like that. But then sometimes there's some radiating issues that occur from the low back and the nerves that control the upper thighs and the muscles that unlock the knee. And what we're able to do is, through our diagnosis, we do a thorough orthopedic and neurological evaluation, as well as digital x-ray, to be able to see which structures are being impaired the most, and
what's causing the pain.
Find out what's causing it, and then from there we can come up with a unique treatment plan for the individual patient with what they present with, and by addressing all aspects of it, that's how we're getting such phenomenal results.
So the pain in the knee could be because of an alignment of the spine, a misalignment of the spine, or it could be from just the bone to bone in the knee, where all the cartilage and whatever else has deteriorated over the years.
Yep, and that's true. A lot of times what we'll see is a degeneration in the spine, degenerative disc disease, where the discs have become much thinner, which puts pressure on the nerves, and depending on which level, we usually see around the L4, which controls this area of the leg. A lot of times that's involved as well. So we can use our spinal decompression to decompress those nerves there, and we use a low-level laser to stimulate, basically to help get more nutrients into the tissues, and then we use our MLS laser to help rehabilitate the cells that are in there.
Which, Nancy, you're going through all of that sort of thing right now.
Yes,
with the decompression. Tell us, before you came into Dr. McPhail's office, how did you feel? What was hurting you?
My left knee, my right knee, and my lower back. The left knee is 100% better. The right knee is 60% better, and the lower back is about 50 to 60% better than what it was.
Okay.
I can now walk pretty good with that severe pain. Before it hurt just to move.
And the time that I was in your office and we were recording a particular segment, you were actually on the decompression table. Very comforting. Sometimes you even nod off, it's so comfortable. But one of the points that you brought out, because I had asked you about the inversion boots. Years ago I had the inversion boots, and the problem with that is that you're straight up and down, and you could actually hurt the spine by trying to straighten it out when actually it's supposed to be sort of a long S curve. And the decompression table does what now?
Does that? Well, we're able to isolate the force specifically at the level or levels of the spine which we're working with. And by doing that, depending on where the degenerative disc is, we can apply the therapy directly to that area, where, like with the inversion tables and whatnot, as soon as you go upside down, it's going to straighten out the spine. And we have curves on our spine from the side which act kind of like a big shock absorber. And when you eliminate those curves, that weight becomes isolated in different areas, causing those areas to wear out prematurely.
It's what we call on the street, that's not good.
Not good at all. No.
So what we need to do is we need to keep that alignment with the big S, but whenever she got on the table, it's relieving. You pinpoint exactly where the problem is, and you're able to relieve that stress that's there.
Yeah, based off of the x-ray evaluation of the patient to determine what the configuration of the spine is, we can alter the angle of distraction, the angle of which we're decompressing the spine, to be able to isolate those specific areas.
Let's go to the knees and the cold laser that you're talking about.
Okay, yeah, we have the MLS high-powered cold laser. It's a class 4 laser. And basically what it does is it stimulates the healing response. Okay, it does cellular respiration, which gets the inflammation out of there really quickly, as well as it helps to calm down the pain fibers pretty quickly.
And that's what Nancy's going through right now.
Yep.
And how many treatments have you had, Nancy?
30.
Okay, wow. So it just continues to get better and better each time. Oh, that's wonderful. And I remember the time that you did it on my knee, it felt, I really probably needed about 10 of them, and had one, and it felt a little bit better right then and there. So it's painless.
No, you don't even know you're doing anything. It's time to take a nap.
I like that. I like that. You've got a free clinic going on every Tuesday, especially this Tuesday as well, right?
Yep, this Tuesday, today at 3 o'clock, I'm going to be speaking about the LKP protocol, common presentation of patients with bone-on-bone knee pain, osteoarthritis of the knee, failed surgery on the knee. Basically, we go over how they got to that point, what some of the common treatments are, and then how we effectively manage it in our clinic.
Wow, got to go there, folks. If you got knee pain, lower back pain, I tell you what, it's a miracle right there on Old Trolley Road, 1709. Make sure you go by McPhail Chiropractic. Doctor, thank you so much, and thank you, Nancy, for coming
Thank you,
in.
Tom.
It looks good. You're feeling much better.
Oh, yeah.
Yes, ma'am. Thank you very much. Got more coming up after the break, so stay with us.